Tell me about the eyes. Everybody wants to have really beautiful eyes and good-looking eyes. What are some of the plastic surgery you do with eyes, especially the upper eyelid? What do you do?
The upper eyelid surgery is called a blepharoplasty, which means basically removing the extra skin and the fat from the upper eyelid. And I think it's probably, as far as bang for your buck in plastic surgery, one of the biggest bangs for your buck because it just makes you look fresher, more rested.
My father had skin that came down over the eye, and I've got that same basic thing. And sometimes I look and say, oh, I wonder what it would be like if I was just bright-eyed and bushy-tailed there. What does the blepharoplasty do for the person? Makes their eyes more prominent?
It makes their eyes more prominent, but it also, in the situation of your father, makes the visual field bigger. So instead of having the hooding, all of a sudden the skin's removed and the visual world is bigger to them.
How about the lower eyelid?
Lower eyelid's a little bit different animal in that basically most folks with their lower eyelids have puffy bags under their eyelids. Some of that is congenital or they're born with it. There are other folks in our part of the world with a lot of allergies and have had a lot of swelling up and down through the years. And suddenly you have an excess bag of fat or just skin or both that you might need to remove.
Which is the hardest to do, and which is the best bang for your buck?
Technically speaking, the upper eyelid's easier and more simple. It's just more about skin. The lower eyelid, you have to worry about the healing process in that you don't want to take too much skin and pull the eye down. Okay, so you don't want to make them look too wide-eyed or bug-eyed. So that's the biggest thing you have to be careful with in the lower eyelid.
What's the recovery time on blepharoplasty, the upper eyelid?
If you did your eyelid surgery, you're looking probably somewhere in the 7 to 10 day range. It varies from patient to patient. Some folks swell more than others, some folks bruise more than others. But if you took an average, it's about 7 to 10 days.
And have any trouble blinking or any trouble, or just good as gold?
Usually pretty much good as gold, but you have to be smart about the surgery, particularly in the female patients who want more eyelid to show so that they can put more makeup and make their eyes look prettier. Sure. You don't want to take too much skin away from them. If you do, then you have trouble closing the lid, and that can lead to a lot of eye problems itself.
I imagine, like every patient, every eyelid is different, the amount of skin that's there and what you have to do. Is it easy to figure out when you examine somebody what you're going to do?
It is oftentimes the most overlooked thing, I think, in plastic surgery of the eyelid is the brow position. So many people have a really heavy brow, so even though you take some skin away, they're still sort of hooded. So many times we want to lift that brow up at the same time you take the skin. So it does require some careful measurement because you don't want to take too much.